How soon can I return to work?
Again, that depends somewhat on the procedure we do, but I like to answer that generally too. Whenever I get these questions about pain and bruising and swelling, I've learned never to say never or always, because as soon as I do, the patient will be the exception. So I answer in generalities, not to be evasive, but to try to cover as many of the mean as I can. If you take all procedures that I do that require general anesthesia and that are going to involve bruising, so that includes rhinoplasty, endoscopic brow lift, SUF lift, deep plane lifts, off the top of my head, that does not include things like upper lip left, where they have very little bruising and swelling, or nostril surgery, where they have very little bruising and swelling, or even removing lumps and bumps and scar revision, which are pretty simple and very little bruising and swelling. So to answer that question, I'm going to limit it to people that have a lot of modest amount of, or we can expect bruising and swelling. And if you take all those patients, the average patient will feel comfortable returning to work in 7 to 10 days. Some patients take 10 to 14. So I like to give 10 as a median. Some will be a little earlier, some will be a little later. Now the earlier ones tend to be the rhinoplasty patients. The later ones tend to be what we call makeovers, where we're doing a facelift with a brow, with a SUF, with other things. So the general idea is that somewhere between 10 to 14 days on average, maybe earlier if you had a rhinoplasty, you should feel, with the help of Miss Clairol, that you can return to whatever endeavor you're looking to return to.